To Eli Larsen. Eli is a 2004 graduate of Michigan State University College of Veterinary Medicine and has been practicing small animal clinical medicine since then. He's currently employed at a small animal clinic outside Milwaukee while, while he works on a medical master's in informatics from Northwestern University.
Basically, what I'm going to talk about is the electronic health record that we use at my clinic, Milwaukee Veterinary Service. A little background about the clinic. It's about a $5 million a year clinic. We see about 20,000 patients. We recently added 2 new veterinarians, so we're up to 8 full-time veterinarians with a staff that exceeds 50. We have 8 exam rooms, 2 surgical suites, and we have been using Impromed Infinity since 1984. Starting in 2007, after I'd been here for a year or two, we started exploring Infinity's capabilities for electronic records. And basically in February of 2008, we went live with that, and we've been all electronic ever since. So I'm just going to kind of run through some of the basic modules that I use on a daily basis, and as much time allows, I'll go with how I use Infinity. Not necessarily how everybody else here uses it. So the first module that I use the most is the scheduler. They call it Easy Time. Within that, it's set up for each doctor as to who we're seeing, what we're seeing, and we use different color codes to denote some information. So we have no-shows. I have a different color for my surgeries, not checked in, emergency slots. We have some rounds, things like that. The other thing that we've used Easy Time for is informing doctors of when lab work comes in. So one of my complaints about Infinity is that there's no desktop like what's in the human field to identify when new electronic lab work comes in. So with 8 doctors, we're sending out massive amounts of lab work. All of that lab work is imported electronically, but there's no automated way of informing the doctors that it's there. So what we have is one person who downloads the information into the medical record also creates an appointment slot in a different area for us to look at. So Dr. Randy here has 3 labs that have been received. They're all from Antech. They're color-coded naturally blue by default. And then as we go through our phone calls, make our messages, then I can change the color to lab work finished and keep track of who I have and who I have not talked to. For all client communication, we use the message center. That's for all of our phone notes. And it covers by doctor. So in this particular image, it's just all the notes for myself over a particular time period. And we have different headings. Anytime the front desk takes a message that the client needs a doctor to call them, they're supposed to put a heading, doctor, please call. And when I'm sifting through 20 messages in a day, that jumps out to me and I know I need to call them. After I've called them, I alter the message to say that I've returned the phone call, and then I know that that has been completed. Something else I can click on in there is to look at all the messages for the client. So in this image, we're looking at Tricia Johnson, and it's every message that has occurred for that client. So we have a record of all phone conversations for that client. It's also broken down into by patient, so I can look at all the messages that I've called regarding Daisy Rose if I choose. Then we get into the actual medical records module. This is just a snapshot of one of my clients from the other day. It's kind of cluttered, lots of different colors to denote various things. We've got forms, I got lab work, I got phone notes in here, I've got diagnoses, and all the invoice items in here at once. Typically when I'm looking for something, I filter it. So if I click on the forms, all the forms show up. All of our physical exams are considered forms. We have some boarding, reservation, consent forms. We have all sorts of other forms that show up. Our dental form is also part of that. I can do the same thing for our lab work. Look for all the lab work, filter it together, along with all of our scanned documents. So when Lakeshore Vet Specialist emails us a report of one of our clients, it is imported as a PDF file and linked to the medical record. So this will also put that in as well. When I first open up medical records or choose a patient, this is typically what I see. got a snapshot of the patient over in this area. I've got a various understanding of where they're at with their vaccines and reminder notes. We have a master problem list, though most doctors here don't use it very often, and we also have a master diagnosis list. And then from there, I can get into more information. This is what our exam form looks like. It is mostly free text. There's not any granular data. I haven't been able to get much traction with the other doctors to do that. So it's a bunch of empty text boxes that we fill in. This is kind of the top half, and we've got the bottom half. So we do have an assessment area, things like that. Within medical records, Infinity has something called vet notes. These can also be called macros or pre-created text. So things that I do frequently, I've typed out as a template, and within Infinity in a text box, I can automatically add text, so I don't have to type it every time. So in this example, I'm in the assessment area, putting in a rule-out list for, I think this turned out to be a fluted cat. So it lists all the typical rule-outs, and then I'll add to it. This is a closer-up view of what my vet notes look like. It's very hierarchical. A little tedious to get through all of it, but it is there. And if I click on, in my plan area, about feline inappropriate urination, I've also linked that to diagnosis, handouts, recheck exams, and things like that. So there's a lot of automatic functions that can be linked to vet notes to save the doctor time. We are trying to use the diagnostic codes, the SNOMED AHA subset. In theory, every doctor for every visit puts in something, whether that's a problem or a diagnosis. My feelings are that we're about 70% successful with that. But this is what it looks like in Infinity when we're using the AHA diagnostic codes. I've also created a custom list, because things that aren't included in SNOMED that I like to know right away is whether or not a dog had a TPLO done or an MRIT or has had a history of a splenectomy or anal sacs removal, things like that, so it can show up on that first dashboard screen. This is what it looks like after a AHA diagnosis search, so it just kind of narrows things down for us when we put that together. Something that's nice about Infinity with the diagnoses is, again, I can link multiple things to the diagnosis. So every time I click on torn toenail, I can automatically generate a recheck call for a technician to call and see how we're doing, and generate a handout on proper nail trimming or anything else that I want. We have two types of lab work. We have in-house and, of course, out-house. Most of the time we go to Antech. When we have in-house lab work that is not machine-based, such as a urinalysis, again, we have it's a form. The data is not granular, so I can't search for it, but text boxes, check boxes for the technicians to fill out. When we have lab work that goes to Antech and that gets imported, that's what this looks like. Same with our CBC machine and in-house chemistry machine. It's automatically imported. From here I can print it off, review it, things like that. Some of this data is granular, so I can actually do some charting on a particular patient, but it's not very consistent or standardized. Infinity, several years ago, added a DICOM viewer, so it can actually interact with our PACS server. And in the exam room, we have a computer in every exam room. I'm able to pull up the x-rays of the client's pets and review with them what the x-rays show, if anything important, and then they can see what we've done with their pet in the back. The image quality isn't as good as on a medical radiograph viewer in the exam room, but it is usually adequate to show people what they need to see. We recently started using LifeLearn handouts, and that's actually part in one of the modules as well in Infinity. So I can actually create take-home sheets or link these directly to diagnosis or vet notes or product items. Something that we use to try and increase communication amongst doctors and all staff members is a pop-up note. So every time somebody clicks on DESI NAC here, a note will automatically pop up first, a warning note saying that DESI has had vaccine reactions in the past. Something, it's not very elegant, but it is a communication tool. And finally, we do use another module called a census module. This is basically patient and staff locations. So we have all our exam rooms, we have various locations in there. And when a patient checks in, they start in the lobby. Then when they're moved into a room, they are moved to the room. When one of our technicians goes in the room, our technicians move themselves into the room so we know who's in what room. And it's all color coordinated by doctor. So pink is Dr. Greta, green is Dr. Is myself, etc. So we all kind of know where our patients are and where the various technicians are that are helping us. And in the amount of time that we have, that pretty much covers the basics of what I do on a daily basis. And if there are any questions, I'll certainly answer those. Yeah, I think Chris or Rob can do that. So I like LifeLearn. There are some limitations to it. One thing that we learned after we purchased it is that for it to work according to how it was sold to us, you have to have an actual copy of Microsoft Word on the local computer. We ran into some issues because some of our computers are dummy terminals and don't have Word on them, and those computers still won't be able to print off LifeLearn. And in fact, if I'm using one of those remote access computers and one of my invoice items triggers a LifeLearn document, it actually will freeze up the computer. Documents are great, and it's all integrated in our website. So you can actually see what it looks like. If you go to our website there, MilwaukeeVeterinaryService.com, find the client library. It's the entire list of LifeLearn. So I think the information is pretty accurate. Import results from all the labs you use. The ones that are electronic. So I'm assuming you're talking about like Antec labs or IDEX labs. Antec is our majority of our lab. All of it will import. There is a function within Infinity that allows you to automatically import that. But the trouble that we were having is that while the computers will talk to one another, get the data into the record, there's no way of informing the doctor that their labs are done unless they have a handwritten copy of what was done the day before. And with this many doctors, that much lab work that goes off, and some labs that take a week to come back, it just wasn't feasible. IDEX I know works, our in-house machines work, but other things, when we send off the masticatory myositis lab to San Diego or wherever, that comes back as a fax and we scan it in. Or some of the UC Davis labs or some other of those specific labs, MSU thyroid panels, we scan those in. Do you like most about using electronic records? The biggest thing is that I can actually read the handwriting of the other doctors. When I first joined here, we were still on paper records, and some of the doctors I have unintelligible handwriting, and I had no idea what was going on. So at least, even if the records aren't complete, I can read what was written down. I also like always having the labs right there. I don't have to go flipping through. Some of these clients who long-term have 50 pages, I don't have to flip through that all. I can filter it and search for it. The biggest thing I find lacking is that desktop. I want to know, I would love to have a list of, I have 5 phone calls to make, 3 labs to finish, and I haven't finished these 4 physical exam files. I don't see too much crashing. But we have had issues, and we've had a lot of network and server upgrades lately. So not the fastest database in the world, but it does just. Thank you. I think I'm out of time.